30 years, 60 years for medicine, 30 years for health promotion, no change. So I think of those who could get to low risk, I think there's some advantage. But I think there's something beyond that. So the issue is, if you're going to say, what's the real precursors to wellness, and not that are something other than just the opposite of precursor to disease. So here are the, oops, no way. Here's some new things. If you're going to design this study, which we're designing, and we're going to change our health risk appraisal, the next generation I call it, keep the same things we have, but put some other ones in there, but some of them I'm going to take out, so it's no longer than 55 questions. What would you add? I've given you a lot of hints. What would you add? What are the precursors to wellness that not just the opposite of precursors to disease? How about resilience? How about optimism? How about positive attitudes? You know, all the positive psychology things that are coming out. There are a lot of things that we can add. Can't add them all, but we're going to try to choose 4, 5, 6, 10 of those. What are the precursors to enthusiasm? How do we measure enthusiasm? And then, can we teach it? Can we make enthusiasm part of our culture? Can we make the desire and courage for high performance part of our culture? And then how do we teach it? Other than just making it part of the culture, that may teach it by itself. When you do orientation, you may be able to teach those things. That's what we do here. We have positive, we have supportive environment. It's characterized by people who have energy, enthusiasm, resilience, creativity. I think that's where we have to go. We also have to get to low risk. I'm not throwing that away at all. I'm saying, well, here's what we have to add. But you can add those in those first two pillars to a great extent. Sound bites from this whole thing. Do nothing strategies that's sustainable. Focus the definition from the absence of disease to high level vitality. I think that's where the goal is, high performance. Total population management, total value of health. The business of health promotion, health management indicates that the critical strategy is help the healthy people stay healthy. That's the critical strategy. Somewhat new. The first step is don't get worse. Let's create winners one step at a time. I'm fitting in Ken Blanchard's study. All of you been to SeaWorld? Are they jumping whales? You've seen those jumping whales? Where do they get the whales, you think? You ever thought about that? Probably not. Maybe we're going out in the ocean and say, jump, jump, and they swim over and grab one and bring it back. But the whales have to jump on command, not just so. That may not be a strategy anyway. Probably did do that. I don't know where they got them. I'm just sort of making it up. Question. I do know where they got them because I spoke to the trainers. It's Ken Blanchard's in his book, Whale Done, if you want to read it. They got some whales someplace, and they put them in a nice environment, duplicated their ocean environment. So they created an environment. They created a safe environment. You don't get hurt here. And then they threw some TPAs in there. Some of them made it. But what they did was build trust. The whales liked them eventually. And then one of the TPAs drew a line on the bottom of the pool. Whales didn't like that because it changed the environment. Eventually one of them swam over and got a bucket full of fish. Got a reward for the right behavior. Well, the other whales, ain't as dumb as you might think, they also swam across, and now everyone's happy. A lot of fish going down the tube. So that went on for a while. But you wouldn't pay $50 to go in for the announcer to say, well, they did it again. Yeah, $50, that's gone. So then TPAs raised the bar a foot. Whales hit the head, nose, that didn't help, they didn't like it, but they eventually learned. Then you raise the bar again and again and again, and pretty soon the bar's out of water and they're jumping. That's what I'm asking you to do. Not asking you to train whales, but follow the strategy. Create the environment, warm environment, build trust, build winners, one step at a time. The first step is just don't get worse. You build winners, set the goals, achievable goals. Don't put the bar up on top of the, expecting to jump. They won't do it. And you get there. It takes time. All right, what can we do with public policy? I think employers, I think you have to read the policy. You're the only ones that are going to lead this policy. The government's not going to do it. The government only worries about health care costs and access. Who pays? That's all they worry about. The whole thing. At least health promotion was on the table this time for the first time ever. Didn't get very far, but it's still on the table. It's got something. But didn't get any more than 3% of the whole deal. So we didn't make any improvement in cost. But employers have to do it. You're the first line. You have to do it. Faith groups can help. Federal government, they can provide incentives for every company can improve their product somewhat in terms of health. The easy ones are the soft drinks can reduce some of the sugar. So the soup companies can reduce some of the salt. There's some things they can do, very obvious, but every company can make some improvement. State governments provide incentives for companies, communities to start healthy cultures in the community. We've seen a lot of that now. A lot of communities are starting to build a healthy culture. Because what's the value of a healthy and high-performing workplace in your community? What's the value? The economic development people should be here. The economic value is maybe companies wouldn't leave, maybe other ones would find a place to relocate in your community. Local communities need to find coalitions of stakeholders to form these healthy communities. And then individuals stop getting worse. There's the first step to becoming self-leader. All right, that's the last slide. What's the point? What's the point of this? I enjoyed coming over to Madison. Why are you here? What's your objective? Well, there's another question I don't know the answer to, but I'll make one up. I think the point is, it's about economics and health and high performance. No question about it. No question about it. But I think the basic fundamental issue is, how do we create a good place to live? How do we create a way to help each other to get through this life with the least amount of pain and suffering? How are we going to do that? You have all the resources you need. Whether you're a large company, a small company, faith group, you have partners out there that'll help. We're not individual silos trying to make this. We're families, we're communities. So how are we going to help each other? I think that's what this is about. All right, that's fast as I can talk for a long time. Thank you very much.